Welcome everyone to Deny, Delay, Depose, Health Over Wealth. Hope you're all doing as well as can be given the state of things, ready to dive into a whole mess of issues today.
Thanks for having me. Always a pleasure, though I gotta admit, some days it feels like we're just chronicling the slow motion apocalypse of common sense. But hey, gotta keep fighting the good fight, right?
Always happy to be here. And, I think there's still a lot of good happening, even if it's not always the loudest voice in the room. We just need to find it and amplify it.
True enough, Sarah. Finding the good is key. But man, some of this news is just soul crushing. Did you guys see the report out of Boulder? The attack at the Run for Their Lives event?
Yeah, I saw it. Horrific. The guy with the flamethrower yelling Free Palestine. And the Israeli embassy staffers in DC just weeks before. It's all so raw. People are hurting, and that hurt is manifesting in terrible ways.
Absolutely awful. I saw that one of the victims was a Holocaust survivor. I mean, it's just layers upon layers of tragedy. What's going on in this country?
It's hate, pure and simple, fueled by, well, a lot of things, but you can't ignore the role of misinformation and how easily people are radicalized these days, plus the constant pressure cooker of social media.
And the healthcare system, don't forget that. It's another kind of pressure cooker. People are desperate, financially ruined by medical bills, denied coverage. That kind of stress breeds anger and resentment.
I agree that healthcare access is a major issue, and it definitely adds to the overall stress levels. I don't think we can necessarily draw a direct line from healthcare costs to a violent act like that, though. That feels like a stretch.
Maybe a direct line is too simplistic, but it's definitely a contributing factor. It's like when people feel like they have no control over their lives, no safety net, no hope, they're more susceptible to extreme ideologies.
Yeah, it's about the overall climate of despair, and the healthcare system is a big part of that. It's not just the costs, it's the dehumanization, the feeling that you're just a number, a profit margin, not a person deserving of care.
Okay, I see what you mean. That sense of being disregarded by the system, absolutely. We see it in so many areas, not just healthcare. It builds a sense of disenfranchisement, right? A feeling of being unheard.
Exactly. And that's where the deny, delay, depose mentality comes in. People feel like they're fighting a rigged game, and that the only way to get heard is to do something drastic. I'm not condoning it, but I understand the frustration.
Right. And that's why, even as we condemn the violence, we have to keep talking about the systemic failures that contribute to it. We have to keep pushing for a healthcare system that prioritizes people over profit. I really believe that's the only way to start healing these deep wounds.
So, how do we move in that direction? I mean, realistically, given the current political climate, a complete overhaul of the system seems unlikely, to put it mildly.
I don't know, Sarah. I think we're closer than we think. The cracks are starting to show. People are waking up. The current system is unsustainable, and sooner or later, something's got to give.
Well, whether or not a radical change is coming, we still have to fight for practical improvements now. Like, look at the proposed budget cuts we keep seeing. They're absolutely devastating.
You mean the ones we were reading about at PBS and Mother Jones? The ones to HHS, the CDC, NIHA? Yeah, those are pretty significant.
Significant is an understatement. Gutting public health agencies like that is like taking the batteries out of the smoke detector while the house is on fire. It is a disaster waiting to happen. Not that anything surprises me anymore.
I know. It's like they want us to get sick. Cutting funding for epidemiology and laboratory capacity at a time when we're facing new and emerging threats. It is utter madness.
Okay, I understand the concern, but is there a way to frame this more constructively? Like, could we argue for better allocation of resources within those agencies rather than just opposing the cuts outright? Is there any fat we can trim?
Trim fat? Sarah, they're already running on fumes. These agencies are the frontline defense against pandemics, against foodborne illnesses, against everything that keeps us healthy. This isn't about trimming fat, it's about dismantling the whole damn system.
I agree with Otto. I mean, sure, there's always room for efficiency, but these cuts are so deep, so targeted. It's clearly not about saving money. It's about prioritizing something else. And what is that, guys?
Well, if we're being cynical, you could say it's about shifting responsibility to the private sector. Let insurance companies and private hospitals handle public health crises, which of course means profit becomes the driving factor.
Bingo. And that's the problem in a nutshell. Healthcare shouldn't be a commodity. It's a human right. But as long as it's treated as a business, these kinds of cuts are inevitable.
And it creates a vicious cycle. The less funding public health agencies have, the more vulnerable we are to outbreaks and health crises. The more vulnerable we are, the more expensive healthcare becomes overall. It's insane.
Yes, and the impact isn't felt equally. Lower income communities, rural areas, they're always hit the hardest. Less access to preventative care, less access to treatment. It exacerbates existing inequalities.
Which again fuels resentment and despair. It's all connected. The healthcare system, the political system, the social system, they're all intertwined, and they're all contributing to this sense of unraveling.
So what can we do besides ranting on a podcast? I mean, how do we fight back against these cuts? How do we build a more just an equitable healthcare system?
Well, I think we need to focus on local action. Support community health clinics, advocate for policies that expand access to care, educate our neighbors about the importance of public health. Small steps, but they can make a difference.
Local action is good, but we also need to keep the pressure on at the national level. Contact our representatives, demand accountability, support candidates who are committed to universal healthcare. We need to make it clear that this is a priority.
Absolutely. And we need to change the narrative. Stop talking about healthcare as a cost and start talking about it as an investment in our collective well-being, an investment in our future.
Yes, and we can highlight the economic benefits of preventative care. Show how investing in public health actually saves money in the long run by reducing hospitalizations and improving productivity.
It's about shifting the focus from treatment to prevention, from reacting to crises to proactively building healthier communities. And that requires a fundamental shift in values.
But shifting values is hard, really hard. So how do we make that happen? How do we convince people that healthcare is a human right, not a luxury?
By telling stories, by sharing personal experiences, by showing the human cost of the current system. People connect with stories, not statistics.
And by exposing the greed and corruption that are driving the current system, shining a light on the pharmaceutical companies, the insurance companies, the politicians who are profiting from our suffering. I mean, they have it too good right now.
Right. And by challenging the idea that the market can solve everything, healthcare is not like selling shoes. People's lives are at stake. We need to treat it with the seriousness and respect it deserves.
Exactly. It's a wake-up call, a warning sign. We can't ignore it. We have to address the underlying issues before things get even worse.
Okay, so we need to fight the budget cuts, support local initiatives, change the narrative, and expose the corruption. That's a pretty tall order. But what else can we do right now today to make a difference?
Well, we can start by educating ourselves, learn more about the issues, understand the complexities of the healthcare system, and share that knowledge with others.
And we can support organizations that are working to improve healthcare access and affordability. Donate to community clinics, volunteer our time, amplify their message.
And we can talk to our friends and family, have conversations about healthcare, challenge their assumptions, and encourage them to get involved. Even small conversations can have a big impact.
Yes, and we can be more mindful of our own health, take care of ourselves, prioritize preventative care, and advocate for our needs within the current system. Empowerment starts with individual action.
It's about taking back control, refusing to be victims of a broken system, demanding better, not just for ourselves, but for everyone.
Exactly. It's about building a movement for health over wealth, a movement for justice and equity, a movement for a future where everyone has access to the care they need to live healthy and fulfilling lives.
That's a beautiful vision, and I think it's one worth fighting for. Even if it seems impossible, we have to keep pushing. We have to keep believing that a better world is possible.
Amen to that. And remember, even the smallest act of resistance can make a difference. Every conversation, every donation, every vote, it all adds up.
All right, that's all the time we have for today. Thank you both for this important conversation, and thank you to our listeners for tuning in. Let's keep fighting the good fight together.
Thanks for having me. Stay strong, everyone.
Thank you. And remember, hope is a powerful weapon.
Before we go, I wanted to just flag a couple other concerning news items. The White House is apparently replacing the NASA administrator after a Trump pick had been tentatively placed. The statement from the White House is that it's essential that the next leader of NASA is in complete alignment with President Trump's America First agenda. That really bothers me. That everything has to be viewed through a political lens now is really quite sad. What are your thoughts about the politicization of the NASA position?
Oh, here we go again. Another field being dragged into the political muck. NASA should be about exploration, about pushing the boundaries of human knowledge, not about serving some narrow political agenda. It makes me sick. It's not like NASA is a hospital. Why does every entity in American life need to be pushed into a single dimension?
I see what you both are saying. The optics are not good. It does suggest that even seemingly apolitical institutions are being viewed through a partisan lens. But, practically speaking, NASA's budget is always subject to political approval. So I guess at a certain level, it's always been politicized. It's just more blatant now.
That's a fair point, Sarah, but there's a difference between needing political approval and having the White House explicitly state that the leader needs to be in complete alignment with a specific agenda. That sends a chilling message.
It's about control, about consolidating power, about making sure that every institution, every agency is singing from the same hymn sheet. It's authoritarian. That's what it is.
That might be a bit strong, Otto, but I do agree that it's concerning. It suggests a lack of respect for expertise and a prioritization of political loyalty over qualifications. It would be really good if qualified administrators were selected.
And it's another example of how these political decisions can have real-world consequences. If NASA is led by someone who's more interested in serving a political agenda than in advancing scientific discovery, then we all lose out.
Right? Because science isn't about politics. It's about truth. It's about understanding the universe. It's about pushing the boundaries of human potential. And when you politicize science, you undermine its very foundation.
And, even if we disagree with the stated motivations behind this decision, maybe there's an opportunity here to advocate for a more inclusive and diverse space program, to push for NASA to address issues of equity and access in STEM fields.
That's a good point, Sarah. We can't just complain about the problems. We have to offer solutions. And advocating for diversity and inclusion in STEM is definitely a worthwhile goal.
I suppose. But it's hard to be optimistic when you see these kinds of blatant power grabs. It just feels like we're constantly fighting against the tide of idiocy.
I hear you, Otto. It's exhausting, but we can't give up. We have to keep pushing for a better future, even when it feels like the odds are stacked against us.
Agreed. And maybe, just maybe, this situation can be a catalyst for positive change. A wake-up call that inspires more people to get involved and advocate for a more just and equitable world.
I hope you're right, Sarah. I really do.
Well, we can only do our best, and that starts with staying informed, staying engaged, and staying committed to our values. Thanks again for this conversation, everyone. Until next time.
Until next time.
See ya.